in the brain injury rehabilitation practice, Dr. Gordon went over how there's two things that are going on. The first is we want to restore the functions that can be restored. An example may be passive range of motion or muscle strength or coordination. The sheer fact of when you're in a bed, anyone's in a bed, has a virus for a few days, you get fatigue. So especially after a huge surgery, just laying around, you're going to be weak. So those are the things that are very typically easy to get back. You do arm exercises, you do activities, you do weights in combination with PT, you're going to get strong. The other part of brain injury, whether it be acquired brain injury or traumatic brain injury, is that at times you have to learn to do things differently when you can't get back to that pre-injury level. This is where the therapists come in and teach a lot of compensatory compensation techniques, learning to do things differently. When we talk about rehabilitation, it's remediation, compensation, and then adaptation. And these things can be done concurrently or sequentially. With compensation, it's repetition of the task, which some of the things that we might do. We might be decreasing the speed of the way someone does an activity to ensure their attention, verifying information, keeping a lot of notes. This is where I was talking about making a memory book, having someone be responsible for their daily schedule, or when they go home, their weekly, planning things out. Chunking information for patients, learning how to group things together so your day goes smoother, teaching someone how to pace themselves, working slower so they're more detail-oriented. When we talk about adaptation, it's now changing the environment or the activity to meet the needs of the patient. Even when you're trying to teach splinter skills, there's just a point where that doesn't work. And a somewhat simple example is if you're working in rehab, you're working on a person's hand strength and they're getting stronger, the muscles are coming back. We're 6 months out, we're 8 months out, a year back, and if they just can't hold on to a utensil, you might try giving them a built-up utensil. That's an idea of adaptive equipment, changing the environment, changing the task because they no longer can improve their motor function. A simple cuff like this, someone who no longer has the ability to hold on. They might have elbow movement, they might have wrist movement, but they don't have intrinsic hand movement. You would use a cuff and that would enable them to be independent, whether they put a pen in there, they put a toothbrush, they put a comb. Again, we're always aiming for improvement, but thinking of new ways to do something if in fact strength, coordination, or cognition doesn't come back to pre-injury level. Assessing and reconfiguring your home would be putting in a ramp if you can't negotiate stairs, putting in a chairlift inside if the flight is no longer going to be manageable, widening up doorways if in fact a rolling walker or a wheelchair won't go in. And I think one of the most important things that we do in rehab, whether it's in or outpatient, is family and caregiver education. It's always part of the treatment process. We try and do it early on with family meetings. We do home visits, and certainly as an outpatient also. Again, basic concept that brain recovery follows patterns of brain development. Gross muscles and movements come back before fine motor. Things are on a developmental hierarchy, and you need to work on basic lower level functions. You need to work on motor functions and sensory functions and even perceptual functions before you can work on cognitive or higher level functioning. Just a simple little bullet point of cognitive impairments, what they may include, and it's just a few. Problems concentrating for varying periods of time, trouble organizing thoughts, becoming easily confused or forgetful, difficulty learning new information, and then having difficulty with others interpreting your actions. They might not match up. Difficulty interacting in social situations, in solving problems, whether that's on paper or mental math problems. Problems with decision making, judgment is often affected. And of course, it impairs your ability to read and write, and also difficulty again with simple or complex math and numbers.